My name is Ada Wax. My full name is Adrienne, but I go by Ada, and I'm a doctor who treats breast cancer. I love, in oncology in general and breast cancer in particular, getting to meet somebody in this very intense, very scary period of their life and get to steer them through that. But then on the other side, get to have these incredibly, long-term relationships with people, with women, get to understand, the rest of their lives and their families and what's important to them. So you kind of get both this really intense medical relationship, but this also just very personal long-term relationship. Cancer is incredibly multifaceted. When you get a cancer diagnosis, it impacts all parts of your life, lots of, your job, your family members, friends. I think it's my responsibility to make sure that every patient has time and opportunity to ask all of their questions, to make sure all their family members ask their questions and hear and understand the answers. What gives me hope is the fact that on almost a daily basis, when I see patients in clinic, I get to tell them that we're doing something differently today than we would have done it 5 years or 10 years ago. So building on that progress, one of my main focuses in terms of clinical trials at this point is trying to find ways to be more individualized or more tailored with the way that we use our very effective treatments for HER2-positive breast cancer, trying to give patients sort of smarter, more targeted treatments that are right for them and their cancer, that aren't necessarily as toxic and, as one size fits all as just plain old chemotherapy. A trial is not the right thing for every patient at every moment, but I love being able to work on clinical trials in my research and then translate that into telling patients, we might have a better way to treat you, a more effective way to treat you, we might have a less toxic way to treat you. We're working on doing better than we did 5 years ago or 10 years ago. I think I have the best job in the world, and I think people look at you oddly when you say that about being a cancer doctor, and I get that. It allows me to meet incredible people at this, very, very difficult point in their lives and walk through that experience with them. And it's just, it's truly the biggest privilege in the world to get to do that.